Good morning. You hear me?
Hello, good morning.
Hi, good morning. Okay.
Just a minute to.
Okay.
Okay, do you see my screen
Uh,
now?
now, but it's not a presentation screen. It's
Yes,
like,
yes, yes. Not yet, not yet.
okay. Okay, so get
Now?
I'm bringing my coffee and we'll wait 5 minutes for others to connect.
Okay, okay. Facciamo.
Ma il mute.
Oj.
Dov'è il mute? Ma la bine?
Ora dalla viene che c'ha la Così. Voy a aquí. مش والله بركة.
Ready.
Hi, everybody. Good
Hello.
morning.
Hi.
Okay, I think we can start. Almost everybody there, no?
Okay. So I can start.
Who's missing? Nastasia. Con is there because Con is also presenting. Okay.
Yes, he's sitting next to me.
Okay, Hila will not be here. Okay, yes, you can start, I think.
Okay. So I'll present my case. Here is Ceph. So let's start according to Downs. We can see that the facial angle is 87, and we have an angle of convexity 10 degrees. So we have a convex profile. The maxilla is forward to mandible. AB line is -9, so we have a class 2 relationship, and we have a high mandibular angle, 31 degrees. Y-axis is into the limits, and dentally upper to lower incisors is 125, so we have procline incisors, and the lower incisor is also procline according to occlusal plane, and we have a slightly protruded upper incisor according to a Pogonian line, 5
Okay. Show me the
millimeters.
Ceph again. Show the Ceph.
Here
Yes.
is the Ceph.
Okay.
And as you can see also to the polygon, is obviously a retrognathic patient. Now, according to Steiner, SNA 88 and SNB 83 will have a protruded maxilla and slightly protruded mandible. So the
And
A and B is, yes.
the SNFH angle, did you measure it? I forgot to ask you when you sent the
Yes, I think it was 7. I didn't put it here, but
Okay. So you didn't need to do correction. This is the
yes,
number.
exactly. Yes.
Okay.
So A and B is 5 degrees. We have a class 2 relationship. The position of the upper incisors is, has a position to the limits, but lower incisor we can see that it's a little bit proclined, 33 degrees to A and B line. Again, the interincisor angle is slightly lower, so we have a procline incisors.
So now you know that the proclination is due to the lower incisors, not the
Yes,
upper.
exactly.
Oh, Dr. Steiner.
Exactly. And we have gonion to gnathion to SNA. Gonion gnathion to SNA is 37 degrees, so we have increased it slightly. It's a hyperdimension patient. And again, according to width, A to B is 5 millimeters. So again, class 2 relationship.
So it matches everything.
Yes, exactly.
So you have here a class 2 and you have some compensations for the class 2. Yes, you have
Yes.
retroclination in the upper, proclination in the lower.
Mm-hmm. According to tweet, FMA is 34, so again hyperdivergent. As we see here, FMIA is low, it's 54, so IMPA is 92. Again, here just see that the patient is hyperdivergent.
What means that it's a smaller angle, the FMIA?
This is because of the hyperdivergent. Also, the profile is not how to say.
It's an angle of the lower incisors to the FH. So if the angle is small, this means that.
Have procline.
Okay, yes, okay.
Yeah, it's because it's the proclination of the lower incisor.
Mhm.
Okay. Now, according to McNamara, maxillary skeletal and maxillary dental upper and lower is into the limits, but if we can see the effective mandible length, it's 113, and according to the table, we have to have some mandible length and mid-facial length, something between 89 to 90, but
Why,
we
why,
have
sorry, Theodore, to cut you.
yes.
Why you started it's like you start with the mandible and you want to match the maxilla. In this case, you look at the maxillary skeletal, you see that the maxilla is okay. The maxilla sitting in the face is okay related to the
Okay.
mandibular.
So,
According to McNamara, you have to go and see now for this maxilla what you should have mandible. What mandible?
okay. So it's the other
Okay,
way around
the
because it's
way
7.
he looked at the things. Okay, so according to him, you have not a small maxilla for the compared to the mandible. It's like
We have big mandible.
79. You don't have in the list 79, but you can look at the 80 and see what
Mhm.
mandible and what mandible do you have here. And according to that, you continue. Okay, this is the
Okay, so it's the other way around
look at the
because
things
we
exactly.
okay. So it's the other way around because effective mid-facial is 79, and our effective mandible is 113. We can say that the mandible is bigger than the maxilla. That's why we have big also different between mandible and maxilla, 34 millimeters. And also what we can see here is that we have a high lower anterior facial.
So usually when you have a big difference, this is indicative of what class?
Class 2.
Class 3. The mandible, you said the mandible is
Yes, sorry.
big,
Yes,
but,
class 3,
but
class
you
3.
still have
Yes.
here a class 2 case. Why?
Because we have hyperdimension, we are
Exactly.
vertical growth.
The lower anterior facial height is
Mhm,
it's big. Okay, go.
mhm,
So the mandible is not a mandible classic for class 2, okay? It's you don't
mhm.
say this is a class 2 due to a small mandible, okay? The mandible is positioned in a retrognatic position because of the hyperdivergence in this case, because it's a high angle case.
Okay. So yes, it's a class 2, but it's because of the position of the mandible and because of
But
the
not the size.
vertical. Okay. Now Jarbag and Bjork, saddle angle it's 100, but it's a cure, but articular angle it's white 160, and the sum of the angles is slightly increased, so we have a clockwise rotation.
Mhm.
But if we see the S articular to gonion is 0.79, so here we have counterclockwise, and posterior facial height to anterior facial height 66%, so counterclockwise.
Okay.
I mean, I think we cannot
Sometimes we
have a
have like,
conclusion.
yes,
Yeah.
he's a high angle case, but he has
Yes.
some compensations, okay? And from Bjork Jarabak, really, you don't tell a lot here because the Ramos is not a small, really small one.
But
Even by looking, eyeballing, okay, it's not small. So
but if
maybe
we see the
maybe
lower
there was
angle,
like, maybe this case like was, you start to think maybe he have some breathing issue and they solve it later and he have some compensations later. Maybe, okay, this is one of the things that could be. Okay,
okay, but also the lower gonial angle is it's high, so this is also an indicator for the
yes, high angle.
high high angle, yes.
Okay,
And now to soft tissues analysis. Soft tissues facial angle is 90 degrees, and we have a small nose because the nose prominence is 30 millimeters. We have thick lips. Upper lips is 16 millimeters. We can see that the patient has stain.
so
Upper lip tip.
yes, one thing to tell you all, you cannot talk about strain if you don't have closed lips, okay? You
Okay.
ignore it, okay? Just if you're safe, you have it with the closed lips, then you can talk about the strain, okay? You cannot measure strain without closed lips. So just ignore it.
Okay. We have inferior skulls depth 6 millimeters, so we have a curled lower lip. And according to Ricketts, to E-line, upper and lower lips are positioned in the correct.
Okay, the nasolabial angle, you measure it, you said something?
Yes, where is it?
Okay, you can tell
Is
now.
it here?
Yes, it's obtuse in nasolabial angle, okay.
Yes, yes. So as a summary, we have a skeletal class 2 patient. A and B is 5. AB plane is -9, and according to which it's 5 millimeters. So everything said that's a class 2 case. Here we said that we have a big mandible compared to the maxilla.
You have to change that.
Yes, I have to change it. We have a convex profile. The angle of convexity is 10. Scalar profile convexity 6 millimeter. It's a tendency is actually a hyperdivergent growth patient. High
Okay.
mandible angle, FMA.
What is his age? He's still growing. This case is
I
growing.
I think it's 13, 14
Okay.
because it's not my case, but I think it's between 13 or 14.
Okay. So for you, it's a high
Uh,
angle. You have to write here. It's a high angle case
okay.
with a
And
hypergradient pattern. Okay.
mm-hmm. Uh, yes, and dentally upper and lower incisors are proclined.
The
Actually, is
upper,
more the lower.
it's
The
just the
lower.
lower according to your
Yes.
measure. I don't know if I didn't check them, but according to Steiner, you have just proclination in the. Okay.
Yes, and slightly and soft tissue have curled lower lip, thick upper lip, and a small nose. As we said, we cannot say about the stain, so I will
Okay, so
remove it.
your lips mainly at their right position related to the E-line, and you have obtuse nasolabial angle also. It's right there. Okay, good, nice. Anyone have a
Okay.
question regarding this case? You think everything is clear, I think, here. Just the issue of that McNamara doesn't match, but we explained it already. Okay, now Con.
Okay, thank you.
Okay. Can you see my screen? Okay. So we can see on the downs, it's pretty much on the normal means. So we can see as deviations on the occlusal plane, where we have a small angle, and which indicates there's it's rotated counterclockwise, the occlusal plane. The lower incisors to the mandibular plane also have a smaller angle, so they're quite upright.
This case after treatment?
No, it's before treatment.
Oh, okay.
He had well, it wasn't a good choice of of a Ceph.
Okay.
But when I chose it, I mean, it just, I just took it. He has a crossbite. Actually, anyway, we're gonna see later on. Okay. So lower incisors to mandibular plane, smaller angle. So this means that the lower incisors are quite upright. The upper incisors to apog is 6 millimeter distance, so they're a bit protruded.
You remeasure it? I think I put you question mark to remeasure this one, the upper incisors. Because by eye, it looks like they are not 6 millimeters. I don't know. From epigonium, because he have a quite protruded pogonium. Okay,
Yes.
doesn't matter. Or maybe later you can measure it, but
Okay.
yes.
So we can see the polygon. For the main part is mostly on the normal values. Moving forward to the Steiner and Witz, again, most of the values were in the normal means. So it indicates that is class 1. We can see, though, that the gonium grafting to SN is 39, which tells us there is a high angle. And the which also, though, indicates a class 1. And there's not much to see here. For the tweed, again, normal values, only the FMIA is a bit more, which indicates also as the downstead that the lower incisors are upright. Which I think will, as we will see later on, maybe is a bit of compensation because he is a class 1, but due to the growth of the mandible, he has a tendency, the skeletal one, to class 3.
Yes, I think so.
So yeah, so I mean, if you saw the patient, up close, he seems like a class 3, but he's actually not. Now for the McNamara, and here we see what I was saying about the mandible. We can see that the poke to the nasum perpendicular is 2.2, which indicates a prognathic mandible. And that's why probably the lower incisors are retroclined. And the correlation between the effective midfacial length and the mandibular length, it was less than we have in the table, though I searched about it and it says that at that age it could be, I mean, he's 15, but it's not that it's very uncommon to be 77, the midfacial face. That midfacial length. And the length of the mandibular length was 107, but that would mean actually that in this case, we have a maxilla that is smaller and a mandible that is bigger.
Yes, exactly.
But bottom line, the mandible is bigger than it should have been, even though the maxilla is small.
Yeah, the difference is big. So
Yeah.
it's indicative of class 3.
Mhm.
Okay.
We can see that the lower anterior face height is increased. And from the growth axis, we can tell that there's a downward and backward growth. I think which actually coincides with the fact that I mentioned, like the mandible is bigger, and then there's a bit of compensation eventually from the teeth. So he's going for a class 3,
And the
but
growth.
it's not.
Two
Yeah.
compensations you have dentally and also a little bit of skeletal downward, backward
Mhm.
growth. Okay.
Okay, moving forward to the Jarabak and Bjork. Not much to see here. Also, the sum of angles is 400, so we do have a clockwise rotation. The Ramos height is reduced, which indicates hyperdivergency, which also we saw before. And the SR2 Argo is also 0.8, so it indicates though a counterclockwise rotation. And the posterior facial height towards the anterior facial height is around 59%, which also I think indicates a counterclockwise rotation. So we do have two counterclockwise against clockwise rotation, but I think
The pattern is more clockwise, yes.
yeah.
Okay.
For the soft tissue, again, most of the things are in the standard means. We have a bit of a nose prominence. I mean, it's less actually, the prominence, so it's a smaller nose. The upper lip width is a bit more, the thickness. The correlation of the lower lip to the H line is more, so we can see that's a protruded lower lip. Also, the inferior sulcus depth is 5 millimeters, so we could say that it's the lower lip is curled. And again, according to the lower lip, according to the E-line is a bit protruded, which again comes to what we said before, that the mandible is bigger either way. The upper lip is fine, it's like -4, so it's in the normal range.
Yes.
Summary, again, so it's a patient 15 years old. The skeletal is a class 1. We could argue that it has a tendency for class 3, mostly according to McNamara. According to the measurements, eventually the mandible is bigger than the maxilla. It is a high angle case. Dentally, there is a compensation for the lower incisors who are upright, according to the FMIA, and the lower incisor to the mandibular plane. The upper incisors are a bit protruded, but I mean, you said that maybe they're not. Maybe I made a mistake with the measurement.
Usually in this case, they look upright, not protruded. Even though in these cases we sometimes see compensations in the upper, but in your case, not.
Mm-hmm.
Yeah.
Okay. And for the soft tissues, I mentioned there's a protrusion of the lower lip regarding the H angle and the E line. And we have also curved lower lip due to the sulcus depth.
Okay. Good, very nice, Con and Theo. I see that now you are doing the things more easy for you. You are more understanding what you are doing, what you are saying. So I want for next time 4 of you to be prepared, because this time we were prepared for 3 and one have something she couldn't present today. So please be prepared next time for to present, because we are doing it really fast, and we have to finish this session and start working on the project. So this is our last one before the vacation. During the vacation, please start work on the project of the superimposition, okay? You will have time, do it. Will not be difficult. Now you understand the cases, you just do a little bit of review what you need to know about the superimposition, and start to work about for this project, and send me the presentation so I can correct, because I want to finish this sessions of the cases for maybe next time after the vacation. First time we finish these presentations, and after that we do the superimpositions. So have a nice vacation, enjoy your time, and we'll see you after that.
Thank you. You too.
Enjoy your
Bye.
summer.
Have a nice summer.
Thank you all.
Thank you.
Bye bye.